Scientific research has revealed that fibromyalgia is closely linked to changes in sensory processing in the central nervous system. A study published in the Journal of Pain Research highlights that people with fibromyalgia have a condition called central sensitization, in which the brain and spinal cord amplify pain signals, making the body more sensitive to stimuli that would not normally be painful. This discovery not only validates patients' experiences, but also opens the way to more targeted treatments that seek to rebalance the nervous system and minimize the impact of chronic pain. Research into fibromyalgia has highlighted lesser-known symptoms that go beyond generalized pain and fatigue. Many patients report phenomena such as paresthesias, abnormal sensations, such as tingling or numbness, without an obvious cause. Another little discussed symptom is sensory hypersensitivity, which can manifest as extreme discomfort to noises, intense lights, and even odors. Fibromyalgia can also impact cognitive functions in subtle ways, leading to what is commonly called fibrofog, characterized by memory lapses, difficulty concentrating, and mental confusion. Furthermore, gastrointestinal changes, such as irritable bowel syndrome, and autonomic nervous system dysfunctions, such as dizziness and heat intolerance, are also frequently reported but often overlooked symptoms. You will definitely like this content, so don't forget to leave your like. This helps the video reach more people and makes all the difference. Like now and help spread this information, especially if you know someone who suffers from this condition. Fibromyalgia is a complex, chronic, multifactorial medical condition that affects millions of people around the world. Mainly characterized by generalized muscle pain and tenderness at specific points on the body, it is also associated with a range of debilitating symptoms, such as extreme fatigue, sleep disturbances, and cognitive difficulties. Although its exact causes are not yet fully understood, fibromyalgia is recognized as a syndrome that significantly impacts patients' quality of life. Causes of fibromyalgia. The origin of fibromyalgia is multifactorial and not completely elucidated, but it is believed to be related to a complex interaction between genetic, environmental, and biological factors. First cause: changes in the central nervous system. Studies suggest that people with fibromyalgia have changes in the way the central nervous system processes pain signals. The phenomenon known as central sensitization causes normally harmless stimuli to be perceived as painful. Second cause: genetic factors. There is a genetic predisposition in family members of people with fibromyalgia, indicating that mutations or variations in certain genes may be involved. Third cause: stress and trauma. Traumatic events, whether physical, such as accidents, or psychological, such as abuse or significant losses, can trigger or worsen symptoms. Fourth cause: hormonal disorders. Imbalances in neurotransmitters such as serotonin, dopamine, and norepinephrine can contribute to hypersensitivity to pain. Fifth cause: concomitant diseases. Conditions such as rheumatoid arthritis, lupus, or serious infections can increase the risk of developing fibromyalgia. Symptoms of fibromyalgia. Symptoms vary between patients and can mimic other conditions, making diagnosis challenging. The most common include: first symptom, generalized pain. The pain is described as a constant discomfort, which lasts at least 3 months, and is present on both sides of the body, above and below the waist. Second symptom, fatigue. Even after long periods of sleep, patients often report extreme tiredness. Third symptom, sleep disorders. Difficulty falling asleep, non-refreshing sleep, and associated conditions such as apnea and restless leg syndrome. Fourth symptom, cognitive fog, fibrofog, memory problems, difficulty concentrating, and slow processing of information. Fifth symptom, other symptoms, anxiety, depression, headache, irritable bowel syndrome, and sensitivity to light, sound, and temperature. What do studies on cannabis treatment for fibromyalgia reveal? Scientific studies have investigated the effects of this plant in managing chronic pain, and the results have been promising. Research published in the Journal of Clinical Rheumatology analyzed the use of cannabis in patients with fibromyalgia. The results showed that cannabis use was associated with a significant reduction in pain, improved sleep, and quality of life in these patients. Furthermore, another study published in Revista Neuroscientia de Unifesp, entitled Medicinal Cannabis in Fibromyalgia, a cohort study for a promising alternative, concluded the effectiveness of cannabis. The use of cannabis extracts has been shown to be effective in controlling pain in patients with fibromyalgia, as well as helping to treat other associated disorders, such as anxiety and insomnia. Treated individuals were also able to reduce their consumption of other analgesic medications. Regarding the adverse effects of treatment with medicinal cannabis, dizziness was the most prevalent, followed by constipation and disorientation. All these effects were temporary, and the patients classified them as mild, concluded the research published in the journal Neuroscience. Diagnosis. Diagnosing fibromyalgia is challenging because there are no specific laboratory or imaging tests to confirm it. It is based on clinical criteria and the exclusion of other conditions. Pain criteria. According to the American College of Rheumatology, the diagnosis can be made if there is widespread pain in at least 4 of the 5 regions of the body, in addition to the presence of additional symptoms such as fatigue and cognitive problems. Medical history. The doctor will evaluate symptoms, duration, and impact on quality of life. Ruling out other diseases. Tests such as complete blood count, thyroid function assessment, and rheumatology tests help rule out conditions such as rheumatoid arthritis or lupus. Fibromyalgia treatment. Although there is no cure, available treatments seek to control symptoms and improve patients' quality of life. The treatment consists of a medication approach with the use of analgesics and anti-inflammatories, used sparingly, although they are often ineffective for chronic pain. Antidepressants. Medications such as duloxetine and amitriptyline help reduce pain and improve sleep. Anticonvulsants. Pregabalin and gabapentin are effective in decreasing nerve sensitivity. Muscle relaxants may be prescribed to relieve muscle tension. And an approach with non-drug therapies including physical exercise. Activities such as walking, swimming, or yoga help reduce pain and improve mood. Physiotherapy. Specific techniques help improve flexibility, strength, and posture. Cognitive behavioral therapy, CBT, helps patients manage the emotional and psychological impact of chronic pain. Acupuncture may relieve pain in some patients, although results vary. And lastly, but with great importance, lifestyle changes such as adequate sleep. Prioritizing sleep hygiene is essential to minimize fatigue. Balanced diet. Although there is no specific diet, avoiding inflammatory foods can be helpful. Stress management. Techniques such as meditation, mindfulness, and breathing exercises are effective in controlling emotional triggers. Living with fibromyalgia. Fibromyalgia is a challenging condition, but with a multidisciplinary treatment plan and adequate support, it is possible to achieve a better quality of life. Educating yourself about the condition, seeking out supportive communities, and working in partnership with healthcare professionals are key steps in dealing with the ups and downs of the syndrome. We've reached the end of this video, and I really want to thank you for sticking with me this far. I hope you learned something new and that this information makes a difference in your life or the life of someone you know. Don't forget to subscribe to the channel and activate the bell to receive more incredible content like this. Leave your like and share this video with those who can benefit. See you next time. Until then, take good care of yourself.